Hello, I'm Tom Johnston, owner and designer of the Mechanical Advantage Stretching Harnesses. Thanks for checking out my YouTube and giving me the opportunity to show you the proper handling and operation of these Maxim, I call them the Maxim stretching harnesses. This is the prone knee flexion. I had to design this one after the seated flexion for more athletes. Most athletes want to stretch the quad muscles to get the return their strengthening. And with the seated knee flexion that I just demonstrated, in the sitting position, the quad muscles are more relaxed. But when I was going to all the clinics with the seated flexion for the athletes, they want to stretch the quad muscles at the same time. So the advantage of the prone flexion harness is going to stretch the knee capsule and the quad muscles at the same time. And the second thing this harness will do is that it will be able to bring you the ankle, your foot, all the way back to completely full flexion. You can put the ankle right back into the buttocks. Where with the seated knee flexion, there's always space for the pulley system. So you could probably achieve maybe what you'd have within 5 or 6 inches of bringing the foot back to the buttocks. 125 degrees, 100 and something like that, 30 degrees. But this one can be full flexion, which the athletes want. So this was more sports medicine, where the seated flexion has been more maybe total knee replacements and more elderly people that aren't really comfortable in the prone position, because you do have to crawl around with this on the floor, and the elderly folks, they're not going to be able to do that. But you younger, the golfers, baseball players, you guys that are maybe still in your 40s, 30s, 40s, that are got hurt with a sports injury and you want to get back out there. I shouldn't even say that age group, teenagers, colleges. We sold a lot of these in the NFL to the football players, many of these. And so let me demonstrate the harness. This one, like I said, you've got to be a little bit more active to be able to put this, to use this harness, because you're going to be in a prone position on the floor. What I used to do is in the sitting position, I would just put this thigh strap, I could just call this the thigh strap. Put the thigh strap across my leg, okay? I'll pull a little bit of the handle out because I got to get my shoe through there like that, because I want the handle to come behind my heel. So I've got this out. Again, I didn't show you how to adjust the strap. Let me start again. There's a big strap under. It's pretty simple to use too. Very simple to use. It's just a big Velcro strap, like that. Opens up, like that, and you can adjust this to fit your shoe, okay, like that. Now what I would recommend is when you fit this to your shoe, the reason why I've added this extra padding in here, there's just skin and bone right here. If you're pulling very, very hard, you can get a bone bruise right there. So I tried to put extra padding in here and design this not to put a lot of pressure on that lower shin bone. So if you're pulling very hard, if you've had a reconstruction and you've got and you really have to pull hard, you've got a lot of problems, I would adjust this so this padding is more on the tongue of your shoe, not up in here. Don't let it get up on here. Okay, the tongue of your shoe is padded. This has got double padding. So you want to adjust it so when it fits the shoe, see, that'd be a great location. See how my laces are right here? Now you can pull as hard as you want. And you're never going to do, I had a bone bruise on there when I started with this old leather strap and like dog collar they gave me at physical therapy, because I had to pull really hard. I had a terrible time with knee flexion after my injury. But anyway, you've got the cuff in position now like that. Okay, now I'm going to go down on the floor at home. You can go down, probably I still use the floor. I like a stiff, straight floor like this at home on my carpet. Okay, I'm going to grab my strap and my handle. Start to tighten up the harness a little bit. You can see, let's say I'll start at about 90 degrees. You have to be, I don't want to forget, you have to be at about a right angle to start to use this. If you're stuck out here and you start to tighten up, the strap's going to just slide off your knee. Okay, so once you're about 90 degrees at about a right angle, you can bring that strap all the way up into your groin. I keep a little tension on it like this as I roll over. Now I go prone position. I roll over at home like this. Grab the strap one more time and pull it up as far as I can. Straighten my ankle out. You see me wiggle my ankle, it feels straight. Now I'm going to start to pull on the harness. You can see how it works. They're straight. I'm going to come up. like that, until it starts to hurt, and I'm just going to wait and relax. Very easy to hold the handle here, very easy. Pulley system's very powerful. Then little by little, I'm going to pull and pull and pull on the handle. You've only got to hold on to the strap, even if you can't reach the handle for a while. Again, I can straighten my ankle out, keep the strap all the way up. And if you get a leg cramp, which will happen in the beginning, you can just let go of the handle and just straighten your leg quick. So don't be afraid to put this on. People would feel like they're closed or there's no getting out of it. You can just let go and straighten your leg out if you start to feel a cramp, okay? So don't be afraid to get in this thing. Tighten it up again. I'm going to roll over. A little more tension like that. Roll over. I still use this one all the time at home, just to stretch my quads after exercise, like this. Now, if you get to the point where you're about to reach the handle, again, like all the other devices, there's my handle, works the same. There's the cord lock, boom, right there. Now I can pull till it starts to hurt and just rest. I do this watching television at home. I just rest my face on my hands and it just holds the handle there. And then in a couple of minutes, I'm ready for another pull. I'm going to pull on the handle though. Don't pull on the lines, just hold the lines. Like with the seated flexion and the knee extension, you always pull the handle. Lock the cord lock, and then just pull a little bit more until it hurts again. Like this. Stretch. You can actually do both legs with the harness only on one side. Watch, I'll show you. See if I can get my other leg in there. At home, when I want to stretch both quads, I can put the good leg in front of my injured leg and let the heel of the harness leg push my other leg down like that. That's what I usually do at home when I'm stretching my quads. Like this. You see, it's just the harness leg is pushing the right leg down for me. And then after I get a good stretch on my right leg, I'll just get it out of the way and I'll finish the injured leg. I'll finish the injured leg alone by itself like that. Like that. And that's the prone flexion right there. Again, when you get all done, this one can't get tangled because there's no loose parts, there's no hooks, it's all just contained. There's really nothing that can tangle on this one. You can throw it in a pile and like that. You just pull the two parts away from each other and it's ready to go for the next time you use it. Yep. There's the prone flexion harness. And last, we're going to show you the dorsiflexion for the foot and ankle. Thanks for your time again.